Hello, and welcome to this episode of the Maryland Risk Management Education Podcast. My name is Paul Geringer, and I'm the Extension Legal Specialist here in the Department of Ag and Resource Economics at the University of Maryland. And today on the podcast, we have one of my former classmates, Dr. Jada Thompson, to talk about some of her research looking at disease outbreak in animals and the impact on the firm with these disease outbreaks, specifically with high path avian influenza. So I'm going to turn it over to Paul and Jada for this previously recorded interview. So Jada, why don't you tell us who you are and what you do?
Yeah, well, I'm glad to be here today. My name is Jada Thompson. I'm an agricultural economist at the University of Tennessee. I predominantly do research on animal health economics, which is my fun way of saying I get to dabble in producer and consumer and trade and kind of all of the aspects of economics of animal health events like diseases like avian influenza, swine flu, or FMD or something like that. So,
very cool. And the reason we had you on, or I have you on today, is to talk about a paper you wrote, I think it was a couple of years ago, focused in on avian influenza. So why don't you tell us a little bit about the paper? Because I think this will be an important topic for Maryland producers who do poultry to hear about.
Yeah, so one of I said animal health. One of my backgrounds is in poultry science, and so I have this passion for these diseases that affect poultry. Probably because I grew up in Northwest Arkansas, similar to Maryland, where it's a very strong poultry area. And so the paper is agribusiness value impact from highly pathogenic avian influenza, and so what we did was we wanted to say there's a lot of stuff out there that looks at producer or consumer impacts. And we wanted to say there are these other effects of disease events on firms and cost structures, and how does uncertainty in the market fit into all of this? And so what we did was an event study of the different stages of the avian influenza outbreak or event that happened in 2015, and looked at how were firms affected? So were their stock prices changing? We did some abnormal return analysis, and then we looked at that across firms that were poultry and then firms that weren't poultry. So kind of to be able to compare the directed. So are there these kind of cross-market effects from avian influenza in terms of these markets?
So why did you exactly want to study this and potentially look at that 2015 outbreak? And what was so important to that to you? You've already said you have this passion for animal health, but.
Yeah, so it's actually really fun. So one, it was at the time, it was it was the outbreak that had just happened in the U.S. And so there was a lot of kind of immediacy of wanting to start to look at this. The second component, it's the largest outbreak the U.S. has had in terms of animal health outbreaks. And so what we have was this really big current case of avian influenza. I think also one of the things that are important about avian influenza versus maybe some other diseases is poultry is one of the cheaper proteins that you can have access to. And so when we have something that disrupts the supply chain for this really accessible poultry industry, it might disproportionately affect different people, and especially like low income populations. And so we wanted to look at how there's this risk and this uncertainty of how these firms are going to be affected due to avian influenza. Avian influenza is also just a terribly bad disease. I mean, you get 75% death rate on poultry. There's mass casualties that happen, and it's a global concern. And one of the other concerns about avian influenza specifically is also zoonotic, which means that it spreads from animals to humans or back and forth. I think we're all aware of that right now with COVID-19, but when I think one of the concerns is it's transboundary, it grows across borders really easily. It potentially could spread to humans. And so there's a lot more of these layers of information that were happening beyond just, okay, some chickens were getting sick, right? And dying, that it was also these other things that were going to affect how we manage business or business continuity during that time. And so we wanted to study that one specifically, especially as we have this maybe more globalized world happening with more trade and more interdependence. It's going to be important to how are we going to manage these diseases and how markets are going to react to them if or when they show up.
Very interesting. And looking at the paper, what does, event study / abnormal returns mean? Can you define that?
Yeah, no, it's a, it's in, it uses this term event study. And I remember when I first got it, I was like, what is it? Also in terms of like learning the methodology. Basically you're taking this event and we're creating a counterfactual. And so what we're doing is we're saying, if we can track maybe the Dow index or the S&P index, and we can use those to predict what these firms might have been in terms of their value, given this disease didn't happen. And then what we can do is we can subtract that difference and say the difference between where the firm should have been if the market hadn't responded to the disease, and then what actually happened, and the difference is that abnormal return. So whether it's high or low, so arguably, we're saying these returns are lower because we have this disease happening. And then we can kind of accumulate those and say, is there statistical difference, right? So if the difference in price is a thousandth of a penny, that's maybe is not statistically significant. But when we start seeing 2 or 3% changes in prices, those are going to start becoming more significant in terms of the effect on these markets. And one of the things that we care about these markets in terms of abnormal returns is that there's this thing called the efficient market model. And it says that markets automatically will adjust to these expected changes in cost structures. So, as I don't always think about the firm, right? Like I a lot of times I think about producers and consumers, but the firms are kind of relating to these cost structures. And for assuming that the market is automatically going to adjust, so that uncertainty is these abnormal returns are adjusting for that uncertainty in the market structure, which means it's going to relate to these kind of costs that are associated with that, which aren't always captured in the other ways that we look at animal disease events. And so the event study is just looking at different time periods and saying, can we see that these difference between what should or potentially could have happened given these models that we use and what actually happened occurred?
Okay, now that makes slightly more sense to me now.
Without the mathy things, right? No fancy equations on a podcast, but.
Yeah, that'd be very hard to show people. I'd have to write that out in the show notes, and I can't do that. That would take too much time. So in looking at this, why break out the timing of the disease event? What's so important about that? And you may have already hit upon it, but what's the really important part to think about?
No, I think that so that was one of the super interesting components I think in the nerdy world of academics, we get really excited about some very specific things. I think this was one of the components about this disease outbreak. And I'm going to keep coming back to this idea of uncertainty that happens, but in this 2015 avian influenza, it started in December of 2014, and it started in a backyard flock. So we have some people who have some chickens out back who got really sick and they all died. And so when we see that announcement of that happening, the markets aren't really responding. And that makes sense, right? The markets are, they're not aware of this. They don't really care. It's not that big of a deal. It's not on the radar. And then we move into the first commercial flock. And that was the second date that we used, which was January of 2015. And now we're getting in a little bit more, it's getting a little closer to home. And so we might start seeing some responses. And then the third date that we used was the first case of avian influenza in a commercial flock in the Mississippi Flyway. So briefly, there's these bird migratory patterns across the U.S. And so there's the Pacific Flyway, I can't remember the one in the middle, and then the Mississippi Flyway, and those, and then the Eastern Flyway. And so I think it's the Eastern one. I really know the Mississippi one because that's what we were studying. But the concern was, these backyard flocks and the first commercial flocks were still in the Pacific Flyway. And there's a lot of birds in that flyway, but there's not as many as maybe that central region in the U.S. And so that third time frame really matched it when when migratory bird patterns spread that disease back up through Canada and around through into the U.S. and that Mississippi Flyway. And now we're getting into commercial layers and commercial turkey flocks. 49 million birds were affected, and that means depopulated or dying of this disease tragically. And so why we wanted to study those individually was it was kind of one of these first analyses to look at and say, hey, even though a disease is announced at a certain time, are those different announcements in making a different impact on these firms and these values. So as people are learning more and more about this disease, it's becoming more and more important. To relate something super current right now, COVID happened in China. I remember talking to my class in January about COVID in China and kind of the effects of a large-scale disease outbreak in humans and the pathogenicity of it and how fast it's spreading, right? But most Americans weren't aware of it, right? Most Americans, it was somewhere else. It wasn't, maybe not that they wouldn't have been compassionate towards them, but it just wasn't in their backyard, so to say. And then we see that spreading to the US, and then it became very important. And so using that same kind of model, it started, it was on some people, it was on the radar, but it wasn't important. And then we looked at that spread, and that's what we showed, was that there was this difference in how people respond to that disease. And so the biggest abnormal returns were really coming from that large scale commercial outbreak happening in that Mississippi flyway. And we can show that, maybe when we're looking at diseases and we're looking at the effects of these, we really need to be aware also of the timing of those and kind of how we study that. And so that was one of the reasons why, one of the kind of side things that we were really wanted to draw out in this paper.
Oh. So. Yeah, that makes sense. And then going back to those abnormal returns, how do those relate to the real world, the real world?
Yeah, no, I think that, this is, I think, is always a really great question, especially for an extension. From a research standpoint, sometimes we do this research and it's like, but how does that apply? And I think as an applied economist, we as consumers, we eat things, and we pay for this food, and we have these price changes that are going to occur because of this disease. And so what we see is this understanding these firms' price structures are changing, and that's what these abnormal returns are signaling to us, might also indicate these changes that are going to happen in prices at some point. And so when we look at how prices might not be super affected if it's a small outbreak, or maybe it's isolated, but when it starts becoming large scale, we might start seeing these consumer effects. And we see this, and there's some theories on sticky prices and how fast those changes. But I think the real world implications of this is looking at how not only are the consumers affected, but how these producers and how we perceive this risk and uncertainty, and how it's affecting these firms and relating to kind of the liquidity and how the financial situations are occurring.
Yeah. And this whole paper is related to the firm, the poultry company side, more or less. How does this drill down to what growers need to be aware of and what they need to be thinking about?
Yeah, I think that's a great question. Because this paper, it's talking about the firms, and I think that there's a lot of stuff about business continuity out there about for the growers, and how quarantines and things and business farm planning management during a disease outbreak. One of the, I think, kind of takeaways I would be interested in here is this, as a grower, would be that this could maybe explain why sometimes during an outbreak you see these prices going up on the store. So I see prices going up at the store level, but I don't see my prices. I don't see my income going up. And so as a grower, I think that what this does is it makes that connection to kind of show that sometimes these firms, their costs are changing, right? And so it's going to cost more to transport. It's costing more to clean and disinfect. It's costing more along those that chain. So that maybe it's just a way to be aware that sometimes maybe the reason why you're not seeing the benefits of those price increases at the store are just because those increases in the price along that chain from you and on. I think at the end of the day, growers are some of the most impacted from disease outbreaks, because they're the ones who are having to deal with the boots on the ground, having to deal with the disease, and all of the financial implications of that. And I think that maybe this kind of just shows a little bit of how those devastations kind of carry down that supply chain and relate to firms and markets down the road. But
yeah, so with all this uncertainty, how does this uncertainty in the effects of these high path diseases, what does that mean for the future? Well, I mean, I think we're seeing some of this play out now through COVID, but what does that mean?
Yeah, no, absolutely. And I think that in the U.S., we've been very lucky to not have these massive, large-scale disease outbreaks as much as you know. African swine fever is running rampant in the world right now, and it's a very large concern. And I know that USDA is doing all they can to try to prevent that getting into the U.S. And we're trying to do all we can. I know farmers are trying to do the same thing. I think that what this, maybe kind of the implications of this is showing that that markets are going to react, and that maybe getting good information into the hands of people who can make those decisions, who are making investment decisions, understanding that firms are going to be disproportionately affected if they are directly related to the industry. So, whether it's poultry or pork or whatever is going to be affected, or beef, that we might be able to understand that and maybe have some, maybe think about risk mitigation, maybe long-term, some kind of policy in that way to address that. And I think that, one of the things is that people are responding, but maybe not initially. And so maybe knowing that maybe that initial call isn't really creating this huge response, and allows this industry, academic, government intersection to be able to come out and provide better information about the implications of whatever disease potentially could happen in the future. I think we show with COVID that, things don't always go to plan, things don't always work out, but that, maybe we could do all we can to prevent that or to help that along in the future.
That's a good point. And anything else you want to tell us about the paper?
I want to thank my co-authors, Carlos Trejo Peck and Dustin Pendle, for all of their tireless work and doing this and getting this out there. It's always, you do a paper and you hope that somebody picks it up, or you hope that it gets in the hands and it's valuable. I think that, like I said, I think the poultry industry is super important, and I think that we, studying that or understanding how this impacts growers and how it affects, diseases are going to impact the firms and the consumers. And I think this is just one way of looking at that. And so thanks for, bringing me on here to talk about it and get it out there.
No problem. Thank you for coming on today. Thank you again for listening. If you have any questions for Jada, I have her contact info down at the bottom, and you can get in touch with her that way. If you have any questions for me, thoughts on future shows, let me know. You can get me at lgoering@umd.edu, or you can tweet me at aglawpaul. Thank you again for listening, and enjoy the rest of your day.